Welcome to Senior Speak New Hampshire. I'm Dan Wise, a volunteer for AARP, which is also the sponsor of this show. New Hampshire is the second oldest state in the country. 20% of us are 65 or older, and by 2030, that percentage will be 27%. We are undergoing a major demographic shift, and while this is happening rapidly in New Hampshire, it's a worldwide phenomenon as well. Population growth is driven by falling mortality, is not driven as much by the falling mortality of adults and not by high fertility. That is, people are living longer and we're not having as many births. So, in fact, the number of children in the world has peaked and will remain constant at its current level for at least a couple of decades. So, people are living longer. What does that mean for our society? Here in New Hampshire, there's a group that's been hard at work looking at those issues. It's the New Hampshire State Commission on Aging. Its new executive director is Lily Wellington, and she's going to help us talk through this topic. Welcome, Lily.
Thank you, Dan.
Thanks. So, we're going to talk about the State Commission on Aging, and first I have to reveal that I actually work for the Commission on Aging also in a part-time role as the communications director. And Lily just came on board just recently, and but she's got a lot of experience in this field already. So let's go through explain what the State Commission on Aging is right now. You know,
sure. Yeah, happily. So the State's Commission on Aging is comprised of 26 members. So when we say members, what we're really meaning is that these are individuals who are both representing individual state departments. So we currently have 8 departments from the state who are on our commission. We have members on our commission who are also in charge of public agencies that are serving an aging population. So we have Easter Seals as an example. And then we also have some retired folks who bring with them a lot of very experienced knowledge around this work. So we have retired DHHS, we have some retired folks from AARP, and we also have members of the general public. So the idea behind the commission is that each of these commission members is representing a really important part of the work and an angle that the state needs to pay attention to. And also representing the varied geography of the state. I think that's really important when we talk about issues related to aging, that aging in the North Country might look a little different than aging in Manchester.
Yeah, and there's somebody, I think, from every county.
Correct.
Is one of the requirements of the commission. Yeah, so how do you come to this work? What's your background?
Yeah, so my initial background was in mental health. I worked for a number of years in supported housing, supporting individuals who had been discharged back to the community from, for the most part, long-term psychiatric hospitalizations. The majority of those folks were themselves in the target demographic, so they were over the age of 55, for the most part over the age of 65. And they needed support to remain in the community, to lead as independent a life as possible. The goal being, we didn't want them to actually need our services, we wanted them to be completely independent. I then transitioned from that work, mental health work, into volunteer management and coordination with the Friends program. So I initially started with the foster grandparent program, where the job there was to recruit folks all across New Hampshire. So it's a statewide program.
A statewide program.
Yeah, statewide program supported by a federal grant. So that's AmeriCorps Senior. And our primary task there was to find citizens in New Hampshire that were over the age of 55, who met very specific income requirements, who were willing to volunteer anywhere from 5 up to 40 hours a week. So to recruit a volunteer who is willing to volunteer for 40 hours a week, get themselves to and from school, They would serve in nonprofit or public schools. So we had folks in daycares and preschools. We even had someone in high school. Actually, CRTC right here in Concord,
Oh, neat.
teaching carpentry. So in exchange for that, they received a small tax-free stipend for their service. But more than that, we found it gave people a purpose outside of self, a reason to get out of bed. The stipend was small, but what they got in return was so much bigger than just a little bit of extra money in their pocket. Transitioned from that into overseeing the Retired and Senior Volunteer Program, which is also an AmeriCorps Senior program. The purpose of that is to, again, recruit a volunteer workforce who can meet critical community needs. So analyzing where are the gaps in your community and how can a volunteer who happens to also be over the age of 55 meet those varied needs. And one of the most successful ways that we did that was through our volunteer transportation program, which was recruiting folks who could drive individuals to medical appointments. We also expanded to offer grocery shopping delivery for free during COVID. We offered free Bone Builders exercise classes. So you name it, somewhere in New Hampshire, there's a volunteer who raises their hand and says, absolutely, I can help in my community.
And was that a statewide? Was that a statewide?
That
thing,
is-
or was that a Concord? Was that Concord?
Great
regional?
question. So it is technically a statewide program, but the sponsors for each of those programs are individual. So right now in New Hampshire, there are 5 RSVPs that are sponsored by different agencies. So a lot of coordination exists amongst those programs in terms of what are you seeing, what are your trends, what are your needs, how are you adapting to meet those needs?
Going into an organization where you're working with volunteers, that must have been a switch from kind of what you were doing before. Did you find, were you surprised at kind of how much energy there was in the
It was
volunteer
great. Yeah.
environment?
I think specifically starting with foster grandparents, that program has my heart. It will always have my heart. What I got to witness as somebody who was coordinating that program was this is genuine acts of love. People going into classrooms and having no agenda. They're not paid professionals. They're not a teacher's aide. They're not in a union. They're there because they enjoy the students. And watching that switch in a student's eyes, you can't put a price tag on that. Seeing foster grandparents who had a time when they would leave a classroom because they would almost get knocked over by boisterous students who were so excited to see Grammy so-and-so.
Yeah.
And also understanding that the thread between mental health work where individuals need purpose and meaning and need to know that they are valued members of their community, and understanding, I think, that that's kind of the tie that binds us all, is where we find that community.
Yeah.
So.
Yeah. So with the Commission on Aging, what do you kind of see as its mission, and what makes it different than some other entities out there?
It is a very unique commission. I will say that right out of the gates. And part of the reason for that is that we are not housed under really any other government or state agency. So we have some independence in that way that is, I think, very critical for what we're trying to accomplish for the state. So when you go back and you look at our charge, what is written into legislation, it is that our primary task is to advise the governor and the state legislator, the general court, around public policy and planning for the state as it relates to aging. And our ability to coordinate that between state agencies and then within the public sector is the true value of this commission, that we are not only answering to one state agency, we're answering to the kind of bigger picture of where the state needs to pay attention or where they can make some inroads. And that is a huge value when you look at the tremendous work that's being done across the state, not only from nonprofits, but from state agencies, and to have some consensus around where we can go as a state in terms of planning
Yeah.
is pretty important.
Yeah, it's a broad mission, and I think one of the things I was going to ask about is, so one of the things that we're trying to do is to make the state more age friendly.
Yeah.
And that cuts across a lot of sectors. Kind of, what does that mean to you? What do you think that? And do you like that term? Is that
Yeah.
is that okay?
I think it's such an interesting term specifically for New Hampshire or New England, right? When we look at who we pride ourselves on being, we are fiercely independent, right? We are independent citizens. We take care of ourselves. We take care of our own. We are invested in our individual communities. We like that we have our own individual communities, and yet we also appreciate this affiliation with Live Free or Die New Hampshire, right? We are independent, and you don't get that way by accident. We have to live through harsh winters, and our ancestors have gone through a lot to be able to dig into harsh earth to put down roots. And that matters because it's in our DNA in that level. So we can't deny that that is part of our fierceness and also our strength. So I think sometimes people hear age friendly and they think, well, maybe. And what I want them to understand is this is about becoming perhaps empowered and contributing and lending your voice to what does New Hampshire look like in 10 years, in 20 years, in 15 years, because it's happening right before our eyes, right? We talked about this permanent demographic shift that's occurring as each moment ticks on. And so what does that look like? What does an independent, empowered tomorrow look like for New Hampshire for folks that are aging? Because the reality is, from the moment you are born, you're aging.
Yeah.
So I think it was Boston, their Commission on Aging, or I think they call it something different, Senior Council, they started to adopt different phrases for age friendly, and it was something along the lines of aging, so cool, everyone's doing it. Because we often think of this as, well, that's for another time. I will think about that when I meet that criteria. And the reality is, at any point, we could all meet that criteria. And those are the types of communities we want to put down roots in. If you're a young family, where can I age in place? Where can I build a life, build a community?
And I think that some of the other aspect of it that I've kind of discovered is that, we talk about aging in the community, we can't be just talking about having to take care of people.
Right.
That it's all is just a series of responsibilities or problems that we have to take care of. There's a lot more to that.
When you look at the data, it will tell you that is 10% of your population are the individuals who need higher levels of care or resources or support. That leaves 90%. That is an incredibly that is an asset to the state of New Hampshire. I don't know about you, but when I have really tough questions and I need wisdom and advice, I often turn to someone who has been through a similar experience. And by happenstance, they are sometimes older than me, right? So those are really valuable. That's an asset to New Hampshire. And I hope that in the coming years we can think about that differently. This is not about a burden. This is about an opportunity. Yeah,
and it offers, the fact that people are living longer and they are healthier longer means that it offers ways to extend the workforce, which is a challenge in the state, for example.
And we see it every day. We see that folks are working, gone are the days, right, when people are retiring at 55 or at 60. Yeah. And not just because, well, I have to work. I need something to do. Yeah. I can't tell you how many times I've heard, I tried to retire and it didn't work. Yeah. people need purpose.
I'm 70 years old.
There you
and
go.
I'm not quite 70. I'm not quite 70, but I like to continue to work. I don't have to work full time, but and fortunately I've found a way to continue doing things that I enjoy doing in a professional setting without it being my whole life. So, you know, I keep having to explain to my kids, they keep saying, I thought you were retired. And it's like, well, I guess I am. It's like, I don't have to work as much as I used to, and I'm choosing how much to do.
Right?
You know?
Right.
Yeah.
Right.
Definitely. And so that's one area where it's you know, it's a value. And then, you know, as we already mentioned, the volunteer component, and I don't know, we don't have any stats right with us about the number of hours that people contribute, but this is a state that already has a pretty strong volunteer contingent, or there's a lot of time that people spend in volunteer work. And the commission itself is an example of that, isn't it?
Yes, I can guarantee you that if we were to pull the stats for the state, well, first of all, I don't know that it would even be accurate because so many people won't even report an hour. They don't think of it as volunteering, right?
Yeah.
But it's hundreds upon thousands of hours that is poured back into the local economy, essentially, that is saving a tremendous amount of money for the state. But it's also just a win-win when you look at, it's also pouring back into the individual who's volunteering. The studies are very clear that volunteer engagement, remaining mentally active and physically active, improve your aging.
Yeah.
Hands down.
Yeah. But some of the policy things that we're working on, I think one of the things that's interesting is there's so many different issues that aging, or talking about aging policy actually touches on. Housing, and workforce, as we mentioned, and not just extending the ability of people to work longer into their life, but also, for example, we're interested in childcare, the childcare workforce and the direct care workforce, because the direct care workforce is influenced by the ability of those folks to be able to get child care sometimes. So it's amazing what it touches on.
And it's incredibly interconnected, right?
Yeah. Yep.
You don't get to the right number of folks in your healthcare workforce without the right amount of childcare, without the right amount of access to housing.
Yeah.
If you can't hire workers if they don't have a place to live, right? So it's this, everything touches everything. And then understanding where can you influence change, right? We can't come in and say everything needs to be different. That won't be realistic. We have to focus on where can we innovate, because what history will tell us time and time again is that when you meet a challenge, you have to make some sort of innovation, and we see it.
One of the things that we're working on too, another issue we haven't really talked about, is transportation. And the state that's a big challenge, and it's an even bigger challenge for folks who are older, who may be giving up driving, or things are just a long distance apart.
Absolutely.
And that's something that the commission's working on too.
Yes. So we currently have a transportation community needs assessment that's in the works. This is a longer term project that is looking at what are the various systems and modes of transportation in the state, and how can those ultimately be leveraged to create better systems for getting from point A to point B. If I live in a more rural community, how can I interact with the healthcare system if I can't get there?
Yeah.
If I live in Concord, across from a hospital, and I can't get to my medical appointments, how am I going to receive adequate medical care? And it's an incredibly complex and moving target. But we know that we are in a different place today than we were, say, 5-10 years ago. Studying it, understanding it, and then learning the opportunities to braid some of those funding opportunities together will just strengthen the system. And it will be a long-term adjustment for how we can ensure that our most vulnerable folks have the adequate opportunity for healthcare
Yeah.
and access to food. Those are primary, right?
Yeah. Speaking about healthcare, something that I hadn't realized until I became involved with the commission is that when you go to the emergency room and it's really crowded and you can't see somebody, you can't get in, or you get treated but they keep you in the emergency room because they can't admit you, that ends up being an elder care issue at some point because there may not be a place for somebody. There may be somebody in an acute care bed
Yes.
who can't be discharged because there isn't a place for them
Yes.
in the system that we have now.
Oh, yeah.
And that's a big cost for the state.
And there are some statistics, I think it's between 76 to 110 individuals who were in those acute kind of long-term hospital beds, not because they had a medical need. There was no place to discharge them to. And so looking at what are our current systems of care and how are we planning, because that's happening now. So if that's happening now, where are we 5-10 years down the road? We kind of have to figure this out. I think the longest hospitalization was like 376 days. And I can guarantee you that person didn't want to be in the hospital for 376 days. That's a very long time. And so determining how we can better support people within their communities, even if that's a different housing option from their home, or what they identify as their home, we have to figure that out.
Yeah, and I think that's something else that I've also been seeing is that it isn't just a stark choice between you stay in your home or you go to a nursing home.
Right.
That we need to develop more
Lots
options.
more layers and
more
levels.
layers and levels, or levels of support within the home. So I think that's one of the things that the commission is trying to work on. Also, I think we're also seeing, this is a statistic I saw recently too, that the number of older people who are poor or who are homeless is growing, and that's another issue that I guess we're going to be
The margins,
looking at.
correct. Yeah, I saw that as well. And it is concerning because so much of this does take, unfortunately, personal resources. And in many cases, time to be able to navigate these complex systems. You know, for anyone that's had to navigate healthcare, you oftentimes find yourself saying, pretend like I haven't done this before, because I haven't. I don't know how to do this, right? I've not been in this situation before. And I think also that the state and providers, both public and private, there are a lot of resources that exist to help people navigate. It's getting people oriented to where's your entry point into those services. Right? The help exists, but figuring out where to go for that wisdom is a little challenging sometimes.
Yeah. What do you see kind of as the biggest challenge for you right now with the commission?
Oh, that's a tough question. I think there's a lot of directions to go in with that. I think that weighing the concerns around the demographic shift and getting people to tune into how we have to begin this planning process now, prior to 2030, which is really, we're already in April, right? I mean, time will march on, and it will get here before we know it. And so if we can focus on these issues now, we have an opportunity to be a little more proactive than reactive. You also can't burn people out on a narrative, which is crisis mode. Because that's also not really positive either. This is an opportunity today. If we can proactively scaffold and build some planning for where we need to go, it remains an opportunity. And so I think getting people kind of focused around that and inspired to start that work is the primary concern at a time where it is challenging for most public or private or state departments, right? We know this. We know that the landscape has changed in so many ways. So people are grappling for those toeholds.
It's important to prove our value.
Yeah.
Yeah. So I know we probably should be wrapping up soon. I want to make sure we put in a plug for, there's a program that the commission runs called the Older Adult Volunteer Program. And on May 14th in the governor's executive chamber, we'll be honoring some recipients from every county in the state for their volunteer contributions. And I haven't seen who the winners are this year, but it's always a range of organizations. It's not just people who are doing Meals on Wheels or things like that. There's a real variety. So May 14th is a date to look for. It's Older American Month in May, and that's why the awards happen then. And I really want to thank you for coming in, and it was a great conversation, and I'm sure we'll be talking about more of these issues
Anytime.
going forward.
Thank you for
again.
having me.
Okay, thanks.